welcome in everyone. Hello, welcome to our webinar hosted by the American Public Human Services Association, also known as APHSA, in partnership with Lyssn. Today's webinar topic is Scaling Child Welfare Workforce Training with AI Technology. If we can go to the next slide. So my name is Francesca Robinson. I'm an instructional designer with APHSA, and I'd love to just take a few moments to share a little bit about who we are and the work we're proud to do alongside of our members. So at APHSA, we represent human services agencies at the state, county, and city levels from all across the country. We're a bipartisan organization dedicated to building common ground and generating practical solutions that work for people and communities. Next slide, please. So we aim to advance the well-being of individuals, families, and communities through three core channels. So that's influencing modern approaches to sound policy, building the capacity of public agencies, and really connecting leaders to accelerate learning and generate practical solutions. Our overall vision is really to just one of thriving communities built on human potential. And then next slide. And since we're on the topic of staying connected, I want to make sure everyone knows about the APHSA upcoming conferences that we're hosting this year in 2025. So we've got conferences in Minneapolis, Minnesota, Reno, Nevada, and Norfolk, Virginia. You can visit the events page at aphsa.org throughout the year to learn more about these conferences, including when you can register, keynote speakers, and the variety of sessions you'll see at each conference. So before I turn it over to our moderator, just a couple of housekeeping items. So you'll notice this webinar is being recorded, and you'll all get the recording shortly after the event. During this webinar, we are requesting that you put any questions for our presenters in the questions and answers panel. The normal chat feature has been disabled for this session, so you'll really want to take advantage of that Q&A feature. Our panelists are going to try to answer responses to as many as possible live, but we'll have time at the end to answer questions as well. So with that all said, it's my pleasure to introduce our panel moderator, Carole Hussey.
Thank you, Francesca. Hi, everyone. Welcome today, and thank you for taking your time to learn more about scaling child welfare workforce training with AI technology. It's super exciting. I think you're going to really appreciate what we have to share today. You hear a lot about AI, and this is really one way for you to see the actual practical application of it within a domain that you are interested in. So we thank you for that. As Francesca said, my name is Carole Hussey. I've been working with Lyssn now for a little while, and I just love what they're doing, and am delighted that they asked me to participate today. As you're well aware, across the country, child welfare agencies are really under enormous pressure, grappling with things like high turnover, complex caseloads, and a workforce that's simply just stretched too thin. And at the same time, the needs of children and families across the nation are growing more urgent. And so scaling the technology, the training through the use of technology and enabling the human aspects of that. You'll hear a lot about that today. This is not a technical presentation per se, but what we're really talking about is scaling high quality training. And it's just not about operational efficiency. When you hear about AI, you hear a lot about operational efficiency, but it's also about protecting the core mission of child welfare, building trust, ensuring safety, supporting families. And so that's what you're going to hear a lot about today. When workers aren't equipped with the tools and confidence they need, the entire system struggles. And so today we're going to talk about scaling that training to address those key concerns. Here you'll see our learning objectives for today. Obviously, we hope that you'll identify how AI technology can create that safe learning environment for child welfare workers. And it's not a once and done sort of thing. You don't train them and then, put them out into the field and that's it. There's a process, there's continuous feedback and solutions that provide that. Improve the ramp up time of your workers and certainly the quality of the services that they are delivering to families. And we're going to show you some practical methods to implement those scalable training solutions to address those workforce issues and programmatic issues that I shared a few minutes ago. So as Francesca mentioned, you're going to be using the QA box on your screen. We'd like for you to use that throughout the session. Please don't feel free, to put it in now. Don't wait till the end. We'd like to address your questions in the context of where we're at in the discussion. So we'll be monitoring that along the way. And we do have two really great speakers with us today. You're going to greatly enjoy what we have to offer. So we have with us Dr. Ernestine Briggs-King, who's the Vice President of Family and Community Intervention at the Krieger Institute. And then we also have Kelly McCauley, who's an account executive with Lyssn, but she's not just any account executive. She has a great deal of experience in child welfare and a lot of great perspective to bring to bear today. So before we dive in, I would like to ask each of our speakers to introduce themselves, and I'll start with you, Dr. Ernestine Briggs-King, please.
Hello, everyone. Thank you for joining us. I am Ernestine Briggs-King, and as Carole mentioned, I am VP of Family and Community Interventions at Krieger Institute in Maryland. Long length of work in this area, maybe 3 decades of work in the area of child trauma and working with systems, including child welfare. So I'm glad to be here today.
Thank you so much. And Kelly McCauley, would you like to introduce yourself, please?
Sure. Thanks, Carole. Hi, my name's Kelly McCauley. I am an account executive here at Lyssn. I am a licensed clinical social worker by trade who was in the field of child welfare for 25 years in Kansas, where I served as director of foster care services over a 6-county region. And then I went to work for KVC Health Systems and the Annie E. Casey Foundation. And in both organizations, I work to help states, counties, small community organizations implement evidence-based practices. So it is a pleasure to be here among friends. Thank you so much.
Yeah, thank you, Kelly. Well, let's just dive right into today's program. We're going to start with Ernestine sharing some information about some of the challenges in the field and kind of lay that foundation. And feel free to tell us in the Q&A window what sort of your biggest challenges your teams are facing in preparing your workers for real world cases and also in supporting them along the way. So if you have some thoughts on that, please feel free to drop that in the Q&A box, and we can advance to the next slide. Okay, and
Thank you. So as we talk about training, David, you can go to the next slide. I think Carole has listed many of the issues that we see today. I think the research is filled with all the things that we could do to really enhance and address some of the training obstacles. But I thought we'd start with some of the things that we're seeing, not only in the research, but in real world at I would say epidemic proportions, maybe, in terms of high turnover rates and how that is really impacting the work that we do and the need for training. Um, Amongst those that we are able to hire and to consistent inconsistencies in their practice, lack of standardization, rules in different regions, right? In terms of actual practice. We are seeing large rates of systemic bias and disparities that feed the disproportionalities in racial, ethnic minorities.
yeah, we're having some video issues here. We're hoping to get that resolved here quickly. If you could just bear with us a moment.
Can you hear me okay?
Yes, we can now.
Okay.
Thank you.
Okay. I'm not sure. Something went off very quickly, so I'm not sure. But you all know about the heavy caseloads that caseworkers face. And I would add to that what I'm seeing here in North Carolina and in Maryland were just the increased complexity of the caseload. So not only were there more, they're becoming more and more complex. At the same time, we're seeing shrinking resources, particularly as it relates to access to preventative services. And all in all, as the workforce ages, we're seeing more of our experienced workers leaving the field and really hard to kind of replace them and recruit new folks that are invested in making long-term commitments to the child welfare system. So in that context, training becomes incredibly important, right? And that one of the things we want to think about, next slide, is how do we begin to rethink our training paradigm. Many times it's a one and done kind of training that we get, and we know from implementation science that it takes a long time to change practice. And it also requires folks to be learning, doing, getting the experience that they need to really help not only build the motivation, but scaffold the skills and build confidence and really create a sense of competency. So, from the research, we know that things that think about child welfare workers in their entirety, whether it's their mental health, whether it's benefits, whether it's other things that really can comprehensively support them, will help with some of the challenges we're having with recruitment and retention that impact training. But one of the things that I find interesting is if we can standardize training protocols by using evidence-based practices and interventions, we can improve outcomes. And I think it's been a little tricky to kind of do that consistently. Um, a, a system that helps provide updates and feedback is often helpful in terms of training and in terms of really helping the worker and the supervisor stay on track with their learning objectives. And so, really thinking about that. And of course, my work has been in the area of trauma. So, I'm really trying to think about how we can create trauma informed training that is culturally responsive, that meets the needs of the families that we serve, and then I think a paradigm that includes some exploration into early intervention and prevention programs so that workers are knowledgeable about what options are out there in the field. I think all of those would really help us rethink the training paradigm. And so as we talk about scaling today, I want that to be the backdrop of the conversation. Next slide.
So I'm going to take a little bit deeper dive on some of those components that Ernestine just shared with us. So from a recent study done by Gopelin and others, we know that organizations have a role to play in helping workers with skill transfer. You know, people are much more likely to use new skills in their work if their training makes them feel motivated, confident in their ability to learn, and shows them why the training matters. None of us like to engage in any effort for time, effort, and energy if we can't see the relevance, and training is no different. Plus, if the environment promotes a growth mindset, workers will be more open to the idea of seeing themselves as those lifelong learners instead of seeing training and skill development as siloed events that we're just trying to check off the checklist. Lastly, by creating safe learning spaces, we know that workers are more likely to be resilient willing to embrace change, and training and practice shift is all about change, and receptive to feedback on what they can do well and what they have yet to learn. Next slide, please. So in addition to the facilitation of those individual characteristics that I just spoke about, Goblin found that these 4 organizational elements also impact learning application, that transfer of knowledge. So first and foremost is supervisor and peer support. This is true especially when we can discuss how training content and skills can be incorporated into practice. It's that bridging work that staff often need between gaining the knowledge and then being able to apply it in the moment out in the field with those children and families. Providing numerous practice opportunities with immediate feedback. And, as Ernestine talked about, the doing part, particularly when learners can receive strategies on how to address their errors or those mistakes that they make, and when they're able to practice the tasks associated with the skills being learned. So let me give you an example of that. In motivational interviewing, if a worker is able to practice the task of identifying strengths as they're developing the skill of giving affirmations, they're far more likely to retain that information. Thirdly, simulations and video examples that mirror as closely as possible the situations in which those skills will be applied, so that workers can practice with the real world challenges that they face every day. The more relevant, the closer we can get to the situations that they face, the better that learning is going to stick. And then lastly, post-training activities that include debriefing with staff on what their training experience was like, doing some goal setting with them about what they would like to learn, what are their training goals, and then helping learners manage their self-talk. These are those messages that all of us give ourselves as learners about how we see ourselves progressing or not progressing and our abilities. Next slide, please. So at Lyssn, we leverage technology to support the transfer of learning of evidence-based practices. So approaches like motivational interviewing, CBT, advanced child welfare practice, and trauma-informed care, just to name a couple. Next slide, please. We do that by taking unstructured conversational data and returning back structured analytics on quality. So what does that mean? Basically, it means that we can take brief spoken utterances in response to training prompts, or whole conversations between workers and role play providers or workers and clients, transcribe what is being said, and then compare it to 70 quality metrics using gold standard quality assessment. Workers then receive immediate feedback on whether they hit the target skill or not. And then the platform provides suggestions on things workers can do to improve their practice. Because even though workers are hitting those skills, we're always looking to raise the standard of care. Then additionally, the data is conveyed to supervisors who are able to use it to provide targeted supervision and coaching. I remember back in the day when I was a supervisor, and more often than I would care to admit to you, I would default to the checklist in my supervision. And many of you out there know what I'm talking about. Did you get your court report done? Did you make your visits this month? How was placement going? Right? The checklist. And, in part, it was necessary because at that time, that type of follow-up wasn't automated. But if I am completely honest, it was also because I just didn't feel confident that I had the type of information to really know how best to support each worker's unique development. This data helps folks see where workers are doing well and where they're struggling, so that supervisors are empowered to give that robust coaching that we all wanted to give. And you can also identify those peer-to-peer mentoring opportunities, which provides some wonderful leadership opportunities for staff that are doing well in particular skills. We also ensure agency leaders are able to access the fidelity metrics for claiming Title IV-E reimbursements, while making those data-informed decisions about resource allocation, trends, and training needs. Next slide, please. So, Lyssn offers two platforms. The first is our training platform. We refer to it as our Learn and Practice platform. Here, workers are able to learn didactic information presented by national leaders in the field. And you'll see an example here of Dr. Teresa Moyers. She's a founding clinician in motivational interviewing. Workers receive didactic information in bite-sized chunks. We have really leaned into microlearning for our didactic portions for two really important reasons. One is that we understand that workers need to be able to fit their training into their hectic schedules so that they can get back out in the field with the children and families that they're serving. And the second is that research is very clear that we can only process and retain so much information in any one sitting. After the didactic portion, workers see examples of how the skill is used in conversations with clients. And then they're able to practice. They're able to do the work of doing with video vignettes as many times as they like within the privacy of their own space. And this is really important. Because workers are engaging with the platform alone, they aren't exposed to the real or perceived judgments of others. And so what it does is it frees them up to experiment with different types of responses so that they can expand their skill set. With this platform, we're able to meet workers where they are. Workers who are new to the approach can access unlimited educational and practice scaffolding, while workers who know the practice well can demonstrate their fidelity and move on. Many of our customers maintain their in-person training to support culture development, peer-to-peer sharing, and relational connection. But then they layer Lyssn on top of that in-person training so that they can mitigate the reality that unless workers are practicing those skills, they tend to fall off after about 3 months from the time of that in-person training. So Lyssn's ongoing practice ensures that skills are retained over time. Also, because we are accessible 24/7, workers don't have to wait for training to be scheduled, which really helps with turnover concerns. Our second platform is our Lyssn QI platform. Workers are able to upload whole conversations, again, be they with role play providers or actual clients. And because there is so much more data collected in whole conversations, the analytics are much more robust. So that in addition to, say, for example, those MI metrics, we can also look at those important foundational skills, such as empathy, talk time, collaboration, and others. On both platforms, supervisors and leaders have access to data dashboards that provide critical information on how workers are doing at implementing the skills. Next slide, please. So this is an example of a real-time data dashboard. So let's say you're an agency that launched Lyssn, Learn, and Practice a few days ago, and you want to see how many of your staff have engaged in the platform. Here you have access to information about which workers have logged in. There's also a data button you can push that gives you the list of all those workers who haven't, so you can go back and do that critical follow-up. You can also see how many times workers have practiced the skills, which skills have been performed or attempted or not yet attempted. Additionally, leaders have access to behind the scenes Excel spreadsheets that allow for some important reconfiguration of the data to capture the metrics that are important to their agencies. So we give you access to the Excel spreadsheets that occur behind these data dashboards so that you can manipulate those fields and collect the type of analytics that may be important to you, but may not be captured on our data dashboard. One thing about these dashboards is that, again, they're available 24/7. And I remember back in the day when I wanted a dashboard, I had to pull the fields that I wanted to see. We have worked really hard to make sure that the information is at our clients' fingertips quickly, easily, and accurately. So next slide, please.
Hey, Kelly, I'm going to just jump in real quick here with a question that we have in the Q&A regarding the legal ramifications of recording client work. In practical application, how does that work? And what should jurisdictions be thinking about relative to that?
So that is a great question. First, let me just say we have a lot of customers who use both platforms and do not record with clients. For those that do, those issues of privacy and confidentiality are extremely important. We are a HIPAA compliant platform, so we within our work are maintaining those critical protections for the confidentiality of your data. For work with clients, it is important that clients consult their own internal legal folks, because you're absolutely right. You're going to need to get consents signed. That'll need to be a very transparent process with your clients. We don't get directly involved into the development of those consents, because each state and county has different requirements. But it is definitely an issue that if you choose to record with clients, that you address. And as part of that workflow process, we have customer success managers that come along beside our clients and help them think through some of those workflow issues that need to be addressed. But yeah, that's a great question and one that needs to be carefully approached for sure.
We had a similar question come in. I think you've covered it, but they specifically asked how you address PHI in the client engagements, and that some clients might not want you to record their sessions. And I think you've
Absolutely.
covered that.
Yeah, and we would never, advise recording a client who does not want to be recorded. It's really important just to make sure that you're considering all of those practical issues before we would ever launch with recording clients, for sure.
Relative to the mock clients that you mentioned, can you clarify whether that is using adaptive AI agents, dynamically responding to user behavior, or if it's operated based upon a predefined script with fixed interactions?
So I just want to sort out a couple things. One, on our Learn and Practice platform, we have videotape vignettes that have been developed after a lot of thoughtful consideration to make sure they're relevant. And again, they fit that real world criteria. Those are set. And so workers respond to those various situations that those video vignettes are presenting them as they're working on demonstrating the skills. For the client conversations, or for those would be dynamic. The role plays, we do offer some supports around topic areas that you might want to do role plays on, how to set up a good, impactful role play. We do have some examples of what those role play situations might look like. We have other clients who choose to have their own role play scenarios. And so we've had it both ways. We've had it be where role plays are scripted. We've also had it be where clients use general kind of templates, scenario descriptions, and then have their role play providers go off of their understanding of what clients might say in that situation. So we've got clients that use both. Good
Excellent.
question. Yeah,
Thank you, Kelly.
you bet. Any other questions that folks have? Okay. Ernestine.
Yeah, so we're going to switch gears and just kind of talk about like what happens if training actually stuck in the way that we hoped it would when we participate in training. Next slide. And I'm just going to give you an example based on my experience of a long time, multiple decades of doing training of the workforce, mental health workforce in particular, but also child welfare and juvenile justice workers and service system providers. And so I am in the midst of working with Lyssn right now to develop a trauma-informed care course. And just wanted to kind of help you see how all the pieces really fit together. So a lot of our training is that micro learning that Kelly described. And that micro learning is important because it helps with skill development. So we provide some coaching, some feedback, and it's real time. It's pretty cool how this really complements what we do when we're doing maybe a learning collaborative where we're spending almost a year with folks and really helping coach them, train them, teach them practical skills, give them opportunities to experience the learning that they have that we're trying to provide, and then give them some feedback on how they're doing, whether it's fidelity measures or other metrics that we can use to see how folks are actually uptaking and implementing what we're training them on. And so this module that we're developing is really going to be dedicated towards mental health providers, but I could see great utility, for example, for child welfare to really kind of just understand, particularly new workers in the force, to really think about the essentials of trauma-informed care and what does that look like? How does that really manifest in their work and in their practice? So next slide. So the work that we're doing really kind of um, gives a really broad understanding of trauma and adversity. And so many of you are familiar with the work of adverse childhood experiences and Vince Folletti and CDC and so many others. And those are those household dysfunction areas that are in the tree, right? And so thinking about physical abuse and sexual abuse, emotional abuse, or having a parent who may be dealing with a mental health or substance use disorder issue. So thinking about those, but also the world of trauma and adversity has so expanded beyond those original 10 ACEs to think about all the things that are happening in the community, whether it be poverty, homelessness, discrimination or racism, um, historical traumas, all of those things that are really embedded in the roots that really impact our children and families within the communities and really tied together. And I guess I don't have to say very much. We could just turn on the news and think about how the climate is really playing into trauma and adversities with the increase in intensity of natural disasters, whether it's record heat or most recent flooding and the secondary adversities that come from those natural disasters, which further compound what our families are going through, right? So really having that broad understanding of trauma and adversity is critical. Next slide. We then take that and really kind of, and David, you can click through all of these, but really kind of embed them in trauma-informed care principles. Things like safety, trust, empowerment, collaboration, and really building a sense of competence around trauma and support, not just for the provider, but for the families, right? And then embedding all of that in the cultural, historical, linguistic, gender, all the things that really kind of impact our families. Our families are not monolithic. They're not single issue families, at least not the ones that I serve, right? And so it's important to really have this context as you understand how to deliver care. And so the course that we're building kind of takes some of these principles and turn them into micro learning things. So safety and trust might be turned into empathy and engagement and the skills that you really need um, to deliver trauma-informed care. Or it may be how to validate a client's experience and listen to what they're saying so that you can kind of create a plan that is um, beneficial to them and their families moving forward. Things like empowerment and collaboration, we see it show up in like collaborative decision making and maybe goal setting, right? All of these things are important for families to advance through many systems, whether it be mental health, child welfare, juvenile justice, as they meet their goals before them. And so these principles are the core for the building of the course. And so the things that we do, whether it's vignettes, whether it's um, sample scripts that we provide really are embedded in these trauma-informed care principles and really complement other training that they might receive in other forays, whether it's in person or not. So just wanted to kind of demystify like what is being done and give you a little taste of what's coming for the trauma-informed care. Next slide. And I think as we think about this and as we think about the work that we do in terms of training, I think we are really thinking about how do we promote resilience and well-being within our workforce and think about all the things that are needed to kind of do this. And it won't all be achieved through a single training for sure, but as we think about this and as leaders in this work, I want to invite you to think about how do you encourage these practices and how do you encourage um, folks that you supervise, programs that you develop to really kind of embody some of these principles. So trauma-informed care, yep, you should do that and really kind of build on those principles that I just mentioned. I think likewise, having culturally responsive services really helps us to engage the different individuals that we may see in our practice and really helps us kind of have a growth mindset, one that is bounded in cultural humility of always learning about different cultures and learning about what's unique about that family and what's unique about their perceptions of their culture and how that impacts the work. Certainly, we want something that's strength-based. And whatever we do, we want to recognize that our families come with a myriad of strengths. They come in, they have assets. They are not just about the deficits that we identify as psychologists or social workers or other mental health providers, but that they have things that we can build on and to use that as part of the work and to really help them build their self-efficacy, their self-esteem, and really kind of promote resilience that way. Um, Next slide.
While we're transitioning there, Ernestine, we have a question that I think you'd be best able to answer.
Mm-hmm.
They're asking if continual improvement through occasional freestyle role play is in recreating scenarios with clients, and is that if that didn't go so well, could be achieved by getting like an instant 70 plus metric feedback, and then after say a 5 minute recorded role play, tangential follow up. Is the role play always between two live users, or is there an AI role? So can you kind of allude to that? You know, relative to
Sure.
your comments also with the scaffolded experiences for staff.
Yeah, and I'm gonna let Kelly chime in too, but of the because our course is still being built, which is really cool. Um, for us to learn about these features, there are things that if you didn't do so well, you can do it again and try again and get real-time feedback on your responses, which to me is amazing. I mean, in face-to-face training, we only have certain amount of time to cover a certain amount of topics, and so this this scaffolding, this building of skills on your own time that's asynchronous is a really cool complement to kind of maybe the face-to-face training that most people are familiar with. But in the course that we're building, yeah, if you didn't do so well, you'll get feedback. Even if you did well, it'll give you feedback on what you did well and encourage you to do more of that next go round. So there's always room to grow and learn and improve. Kelly, anything you would add to that?
No, I mean, I think you did a nice job, Ernestine, of hitting those highlights. The only thing I would add is that for us, that ability to provide that immediate feedback to a worker really helps shorten, I would actually say strengthen their ability to apply the information. Because, you know, for those of you that maybe because of Family First, we're looking at using human coding teams to help with ensuring fidelity to a practice. You know, human coding teams have some limitations because they have to go out and observe, then they do their transcription, then they write up their report, then they get the feedback back. And that may be weeks or months after the worker has actually done the role play or the vignette. With this, they're able to get that feedback immediately. So that transfer of learning is really strengthened because it follows immediately after the behavior that they've demonstrated.
Mhm.
Yeah.
Kelly, one follow-up to that too. Justin also asked, you know, is this like one player to one player, or can you switch actors with the same staff person so they get to role play with different types of other actors?
So on the Learn and Practice platform, we have 5 modules. I'm just going to talk about motivational interviewing to give you an example. Motivational interviewing is divided into 5 modules. Each one of those modules has 4 video personas that are presenting a different challenge or situation for the worker to address. The 4 personas are carried throughout those 5 modules, but in each module, they're giving the worker a different set of challenges to respond to. So that's the practice and learn platform. On the QI platform, where workers are able to upload conversations, again, whether those are role play scenarios or client conversations, within those role plays, our clients can determine how many conversations they would like that worker to upload to get that fidelity, right? So we have some of our clients that may ask their workers to upload a role play scenario every other month. Or we have some that ask them to upload those role play situations for fidelity monitoring once a quarter. It really depends on the client. And I think that's one of the things that we strive really hard to do is to work with our clients to understand what's the cadence and the sequencing of that learning that they would like their workers to be involved with. And we're there to help provide best practice and what our experience has shown us. But we also are very mindful of meeting our clients where they're at and what their training goals are. So there's flexibility there based on what the clients need.
That's great. And then just one quick follow-up question, and then we'll go back to Ernestine. How are those content areas, this gets back to like jurisdictional needs and tailoring, a little bit the tools to them, but how are the content areas identified in the platform? So for example, if a jurisdiction is using a modality that's not included kind of out of the box, if you will, are you able to add those content areas or pull things out? And then how do you train your AI tool for fidelity to the new things that you're adding?
Okay, two really good questions. As far as how we make decisions about adding new content, we really listen to our customers and our prospective customers. So when you're a Lyssn client, one of the things that we're excited about is every quarter we bring all of our customers together to exchange ideas, so that they can share with one another and learn from one another how they're using the platform. And within the context of those conversations, a lot of times there will be ideas about, hey, we'd really like you to consider this evidence-based practice, or this is a topic for a vignette that our workers are experiencing that we don't see on your platform. And so then we go back and we talk to our development team and we make decisions about what content we can add and what vignettes we want to add. And we add that content and those vignettes at no additional cost. So when you have a subscription to Lyssn, you are able to access all of the trainings and vignettes that we offer. Then the client leadership is able to determine which of those training tiles they'd like to turn on or turn off for their staff. So that's a little bit about how content gets added. With regard to how our language models are trained, I think one of the things that we really strive to do is to make sure that we have the highest quality of analytics. And so our analytics are trained on expert conversations between providers in the field. We don't rely on ChatGPT. So making sure that the quality of information that goes into our large language models is high has been something that has always been really important to us. Yeah.
That's great. Thank you, Kelly.
And I
Ernestine,
would,
let's head back over to your
yeah, and I'm just
presentation.
being
Thank
mindful
you.
of time as well. But I would just add to what Kelly said was, so we're in the phase of helping the system learn responses, and we get to contact experts all over the country. Through our relationships with like the National Child Traumatic Stress Network or universities and others all over, that really kind of help you to really understand how someone with expertise might do this, but also someone that may be new to the field might respond just to feed the system a little bit more. So anyway, it's pretty cool on how all those things fit together and how the system gets built. I will say, just in terms of promoting resilience and well-being, family-centered practice, wraparound services, maybe even trauma-specific interventions are other things that we know really help child welfare workers understand and do good practice. And so those would be other things I'd put out for your consideration. Next slide, please.
All right. So in my previous comments, what I hope you can see is that this is how one organization, how we at Lyssn, strive to address that transfer of learning dilemma by providing workers with that foundational didactic information, those unlimited practice opportunities with immediate actionable feedback, and then using those real world scenarios that come up. And at the same time, right, making sure that supervisors and leaders have access to the coaching insight that they need to be able to impact a worker's practice. And so that leaders can have that assurance that workers are capable of delivering services to children and families with fidelity. So clearly wanting to make sure as a high priority that workers are well prepared to go out into the field and do their very best to serve the children and families that they encounter every day. There's an additional benefit when you use high quality data. And this is one example of that. So we had a customer that wanted to see how our empathy data overlaid with their retention data. And what was validated and was later used in working with their staff so that, again, we could reinforce the why of training and practice and implementation of fidelity. In this slide, what we were able to share with workers is that empathy matters, right? Workers who have low empathy scores had an average retention rate of 6 weeks, whereas staff that had high empathy scores were able to retain their clients in care for 23 weeks, right? This is the power of information. And as we know, it impacts a worker's understanding about the importance and value of training and practicing and monitoring that fidelity in those approaches that we know impact individual and family outcomes. And so I share this with you as one of the things that can really help launch an agency's practice shift. It's all of that work that we talked about in terms of making sure that those practice opportunities are available, making sure that the learning environments are safe, making sure that supervisors have the level of information to be able to do that high level coaching, and being able to ensure that agencies have access to this kind of quality data to continually reinforce for staff the why, right? So that we can help support their transfer of learning. And with that, Carole, I'm going to turn it over to you.
Thank you so much, Kelly and Ernestine. Incredible information you've shared with us. We've covered a lot of ground here today, from the challenges of the workforce training to the promise of these new AI tools. I say new, but they're being used everywhere. So very proven. And now we'd love to hear from you. We've had a few questions along the way, but if you haven't already had a chance to drop a question in the Q&A box, please feel free to do so now, and we can try to cover those while we're waiting to see if anything comes in. One thing I'd love, Ernestine, if you could share with our audience, any lessons learned for sort of getting started in, scaling and advancing your training through the use of AI tools. What prompted you to do it, and any insights you can share?
I'm a geek. I love the challenge of training, and have been doing it for a while, and realized that we have to think out the box, not only to meet the kind of demand, but to ensure high quality training continues to happen at a rate that is responsive to the field. And so um, I've been doing a lot of work around implementation, dissemination, adaptation from a clinical and research perspective as I do training across the country. And it's been great. We've seen great outcomes. We see kids get better. We see higher retention rate of employees. We see greater competency. We see it impacting policies and practice in a way that we know it can if done well. Um, but the field is advancing way quicker, and so we need some new tools. And so I'm really glad to be exploring this as a partnership because As a psychologist, I will tell you, we will never have enough psychologists to meet the mental health needs of folks, children and families, in the US and probably globally. And so we have to think out the box around how do we build a workforce that's qualified to meet the complexity and the needs of families that we're seeing today. So that's what stemmed my partnership, and it's been a great one so far.
Yeah, thank you for that. And I love that you rattled off a whole lot of reasons why this is so valuable, to outcomes and to program and practice. And those sort of KPIs are exactly what organizations need, in these very challenging times that we're facing. I think we have time for one final question here. Is there any guidance for organizations navigating ethics in regard to the use of AI in training? And for those that are new to using AI, there aren't really many policies since it's advancing so quickly. We have heard concerns about environmental sustainability. I don't know, either one of you that, that could add that's a couple of questions there. So the ethics in regard to the AI in training, and then also how to navigate with the speed of the acceleration with this technology.
Yeah, I'll take a first stab, Ernestine, and then give you the final say. You know, at Lyssn, we understand that not all AI is created equally. And so it's really, I think, important for agencies and organizations to ask those difficult questions about the technology that they're looking at, and what research basis is it relying on, and what are those practices to ensure that it's being provided in a way that supports ethical work of kids and or workers for on behalf of children and families. We have our company is founded on by three university researchers who are very committed to make sure that Lyssn is transparent, and that we are striving to put ourselves out in the field with over 70 peer-reviewed journal articles to ensure that the metrics we're using, the approaches that we're taking, are what is known as best practice, right? And that's a moving target. I would also say we have a resource. Brian Pace is one of our leaders, and he's done an amazing job in terms of constantly raising that question for us internally. And he has a guide that speaks to what are those quality approaches in AI that you want to be using as a metric, because again, they aren't all created equally. And so folks have an interest in understanding that guidepost, that sheet that we have available for folks. Please just reach out and I'd be happy to share that with you. But it just gives you some guidelines and things to consider as you're doing your exploration about which tech solutions will work best for you.
Thank you,
And
Kelly.
I would just briefly add, just, continuing to ask those questions as technology progresses and as you explore different platforms for training and use of AI and maybe other aspects of your work. I think privacy, confidentiality, and all the ethical questions that tend to come up definitely need to be discussed and like explored. So as a clinician, as a researcher, as maybe even a parent and family member, I would want all of those things to be a solid part of the work that I'm doing. And so I think just keep asking those questions. I think that's a good place to start.
Love that. Thank you for that. And thank you both, Kelly and Ernestine, for your time today and sharing your insights and experience with all of us. We had a really great turnout, and we were so pleased about that. So thank all of you for joining us today. There were a couple questions we didn't get to. Our contact information is on the slide for you. So if you want to discuss further, please do reach out. We would love to continue the conversation. We know your time is valuable, and we hope today's discussion really sparked some new ideas for you, and even the questions about ethics and challenges and concerns. They're all great discussions to have. So let's keep the conversation going about how we can continue to scale and provide compassionate training solutions. And if you're interested in diving deeper into the solution or getting started, just reach out. We'd all love to connect with you. And thank you to APHSA for hosting us today. We're really thankful for that as well. Have a great day, everyone.